I'm Alexander Heffner, your host on The Open Mind at home. Delighted to welcome today to the program Rachel Graham. She operates an invaluable news source, the COVID-19 news aggregator. It's a Twitter handle that she started several months ago to document all of the important news related to COVID, its emergence, and its presence in our society today. And Rachel and I have been giving each other some comfort through DMs over these months to try to stay focused on how society can recover from this pandemic. Rachel, I hope you and yours are still staying well.
Yeah, we're all good here in Southern California.
That's good to know. And Rachel is an author, a public health communicator, and someone who just seemed to have such prescient insight in guiding the Twitterverse through this moment. And you can find her handle accessibly, publicly, COVID-19, it's V2019N. But when did you sort of have an instinct based on what was transpiring that this would be a huge public health event, if not catastrophe?
Early January, very early January, I was following Flu Trackers. It's a blog they're aggregating news from all over the world and about diseases and ongoing epidemics, and they started paying attention to this very end of December, very beginning of January, and updating their blog with Chinese news sources. And it became pretty apparent early on in January, if you were following the Chinese news sources and the translations, that there was something major happening, and it looked a bit like SARS, but was different.
That is so really helpful because there had been this 2-decade period, many years in between what we anticipated might be the big pandemic then, which was mitigated successfully and really eliminated for the most part. And the explosion of imagery because of what you were documenting in stories that you would find on social media, present them to a community that was gradually becoming aware of the scope of the problem. One of the things that you and I observed very early on was, even though it's a communist government and even though it's still China and not a free press, there were photos and videos and very clear warnings. I mean, wasn't that a big evidentiary basis to conclude, this is really something that's grown in scope already. It's not just a few people who've been diagnosed.
Right. In authoritarian countries, it helps to look at what they're doing instead of what they're saying. And when they start shutting down and you start seeing lines outside of hospitals, I think China was saying through mid-January that there was no human-to-human transmission, or it wasn't easily transmitted. But that sort of contradicted a lot of what we were seeing in a lot of the reports, and some of the reports about healthcare workers being infected. So you're right, the media, the Chinese media, even though it's not a free press, some of the stories were getting out, and they were alarming. And they were alarming the experts.
Right. And what was the most alarming thing from the outset for you?
It wasn't, it's a really good question. I think the fact that the people in Wuhan maybe weren't as concerned initially. You didn't see people wearing masks in the streets. But there were there's so much great journalism and great journalists in China. Hopefully they haven't all been kicked out. But the Wall Street Journal has many great journalists there, the New York Times, Washington Post, different outlets. And they were expressing concern about what they were seeing on the ground also, long before, lockdowns happened. And of course, I think the real frightening part of it in early January was the fact that the Chinese New Year was coming up. And that was sort of going to be an exacerbating series of events with people traveling and congregating. And a lot of the pandemic experts that I follow were extremely concerned that this was sort of the worst case scenario with the new year.
So it was that transmission, and I spoke to you and John Cohen and Michael Minna early on, like in the January period, and there were people even in the scientific community. I remember I was interviewing John, and I said, this is really SARS 2.0 in terms of transmissibility and in terms of the devastation. And I think that the flu-like symptoms from the outset that was such a poor communication from the government line in China, and then just repeated by the United States, by Governor Cuomo initially, by President Trump. And it was like the novelty of it could not be appreciated in the way that your particular public health communication expertise helped with the aggregation that you did, because you were aware of the potential scope of the crisis, and on your Twitter account you quoted the former HHS secretary Michael Levitt, former governor of Utah. Everything we do before a pandemic will seem alarmist. Everything we do after will seem inadequate. And it was really only a community on Twitter. People like to say Twitter isn't real life. Well, Twitter kind of became real life because of people like you and others who were caring enough for their fellow citizens to aggregate this information. And, it's really a credit to all of that work that you've done. So I just want to thank you.
All the credit goes to the experts that I follow. And there's a couple who are risk communicators, Dr. Jody Lander and Peter Sandman. And they wrote the book on risk communication. In fact, they wrote the guidelines for WHO a number of years ago. And they know that world. They know what should be said. They've gone through H1N1 and the confusing messaging on that. And they have guidance on their website of then they just actually posted more guidance through CIDRAP and with Dr. Osterholm about how we should be communicating the risk and the ongoing risk. And it's worth reading. And they're fantastic. They say, public officials should not be comparing this to the flu. They said that from January. They thought that the WHO should be using the word pandemic much earlier as a rallying cry to get people aware and motivated and prepared, psychologically prepared, supplies prepared. And my Twitter account grew by 10,000 a week through January and February and March as people started to reach their consciousness, as they started to wonder, how do I need to prepare for this? I'm being told by some people that it's just like a flu. And then other people are saying the pandemic is coming. Dr. Messonnier in the end of January said, we're preparing as if this is the next pandemic. But it was mixed messaging coming from the CDC, right? Some of it was the flu is worse up and through February. And, I think we can all see now this is worse, especially right. You're in New York. I mean, you can see it on the ground.
Yeah, you can. The resistance to the pandemic declaration, there's suspicion that it is economic. It was sort of a geopolitical consequence of China's relationship with the world and potentially importing this and wanting, to basically have the World Health Organization to, sort of shepherd them through the process in a way that's not going to backfire, retaliation because they discover, what they said was inaccurate.
I think there was some hope that could be controlled, but people like Osterholm were saying it's transmitted like the flu. It's going to go around the world. We're all going to have to deal with this. And he was saying that in January. And there were lots of experts saying that in January.
Lori Garrett, of course,
Yeah.
particular, Pulitzer Prize winning writer. I would say on the Open Mind, we have covered this subject. And I just remember, countless guests in the science realm saying, we're really vulnerable from a supply side perspective. If there is a pandemic and if we have outsourced everything in terms of ingredients of drugs and medicine,
Sure.
we're deeply vulnerable.
Sure. Dr. Gottlieb was talking about that in January. So were a number of experts. The director of the Johns Hopkins Center for Global Health Security was talking about that in January, the supply chain issues, the pharmaceutical supply chain issues, not to mention the PPE, which many experts were talking about in January and early February, concerns about N95 masks and the other PPE equipment, because so much of it's manufactured outside of the United States. So there were many, many warnings that weren't heeded, not just by the US, but by other countries also.
What's been most revealing about running this Twitter account that is considered by the scientific and political community? I mean, you have many, many followers, a lot of citizens, and a lot of just active people who want to be educated on Twitter. What has been most revealing about running this Twitter account?
I think people want sort of a apolitical, non-biased, just source of news and information. And there's a lot of distrust in media sources, unfortunately, for many reasons. And but this account tweets those sources. It tweets studies that are preprints, and also studies in JAMA and other reputable sources. I think what's neat about Twitter is you can see experts discussing the latest research in real time. And I think that's what's incredibly unique about Twitter during this pandemic, is you can follow these people, see their lines of thinking. They interact with other experts in their Twitter feed. They interact with lay people who don't understand. They say, can you dumb this down for me? That's what I love about Twitter is this immediate information and discussion of the information, and the fact that it can be translated to lay people. There's really no excuse not to be fully informed about this pandemic that we're all living through, because there are many good sources of information. There are bad sources of information. There are conspiracy theories. But the one that's particularly bothersome right now, I think, is this idea that there are fewer deaths from COVID. And pretty much all the data we have is that the deaths have been undercounted, not just in the US, but other countries also, because people died at home before they had a test. I lost a relative in a nursing home in New Orleans. He wasn't tested, but he died from pneumonia in March. And certainly possible it wasn't COVID, certainly possible it was COVID. That was the very beginning of New Orleans' terrible outbreaks. So I definitely think there are undercounted deaths. So.
Yeah, I mean, it seems that condolences to you and your family on the loss. There were a lot of reports early on in these months of this kind of surge in flu-like illness but the difference wasn't flu-like, because like we've established that it required hospitalization. And that's the unique thing about this pandemic. People have noted that it has crippled a certain segment of older communities, nursing homes, vulnerable populations, folks with pre-existing conditions. But at the same time, it seems to attack people randomly who are in good health, a young age, and require hospitalization and care for the patient for 2 or 3 weeks to recover. And that particular condition, is something that is going to have vast ramifications for the whole organization of the medical and healthcare community. The idea of a disease, if it continues to be out of control, that absorbs so many resources of the healthcare system, and to keep people alive, even healthy people alive, it risks so much exposure within the hospital system.
Right, and there's still so much we don't know because it's a novel disease. We don't know how long our immunity lasts once we become infected. We don't know how easily children can spread the virus. There's some studies now they're doing that should give more answers on that. We're learning stuff about COVID toes and clotting issues. Again, this is why Twitter is so remarkable, because you see these studies and you see these warnings. I mean, some of the Italian physicians putting out warnings about different things, some of the physicians in the UK talking about this syndrome that's affecting children. And it's a sort of global network of information, especially when countries perhaps haven't been able to get this information out easily other ways because everything is moving so fast.
The quote that you have now on your COVID-19, and again, for those interested in watching us on PBS stations, it's at V2019N, which is Rachel's COVID-19 handle, aggregating minute to minute, day by day, all the COVID-related developments. There's nothing left to warn against. You're quoting New York Times' Donald McNeil. There's nothing left to warn against. Everyone, almost everyone, understands. And you've done such remarkable work, not only in sharing important news, but also encouraging folks to give to local food banks and pantries, and updating every day or every week with a new community that is particularly paralyzed by this. So Houston Food Bank is one that we want to give a shout out to right now. Of course, there are a lot of vulnerable cities and rural communities too, rural hospital systems. But, it strikes me that almost everyone clause is still gnawing at me, that almost everyone, certainly, yeah.
I'm not sure that they don't understand. It seems to me that they do understand the risks by now. And it seems to me that people are moving, and some people, not the majority according to the polling data, but some people are moving into what is acceptable losses to quote unquote save the economy. But most public health experts that I follow say this is not an A or B choice. And, the Chinese president tried to open China back up early. And when you have a large percentage of the population that's still fearful of enclosed spaces and contact with others, and you have some states that have embraced this masking and other areas that haven't, people are not going to go out and stimulate the economy until they feel safe. And, Fredan testified yesterday before Congress that reopening isn't an on and off switch. It's like a dimmer switch. And I thought that was really powerful messaging, that you need to be able to slowly get things. And then if you see cases rising, start shutting it down. And I think I do like the idea of what some of the states are doing, reopening outdoor areas if they can control, crowds. And because a lot of the experts I follow seem to think that these are the less risky activities, and people really want to get out.
You've followed all the international developments. The countries that have succeeded, at least in limiting exposure or fatality, at least two of them, New Zealand, Australia has done a pretty good job too. You know, it wasn't necessarily rocket science if you had followed the developments and seen the images coming from the streets of Wuhan to say, let's close the Port Authority, right? I mean, travel ban that would have been implemented might have made sense. There was no ban, and as a result, there was
certainly quarantining people who had been overseas for 14 days, which is what New Zealand did, right? I mean, they told people you can come, but you're going to be quarantined for 14 days. I think a number of countries then instituted that because we sort of learned with so many asymptomatic people who might be infectious that temperature checks may not be that effective. But it's a learning process. I mean, even seeing what we saw in Wuhan and Italy, how does that translate to this particular US system that we have with, I couldn't really see how these lockdowns, I didn't really see as much of the country as did follow these lockdowns abiding by them. And that sort of surprised me. It doesn't surprise me so much that people are really trying to reopen now, but
Germany is the case study so far in a comprehensive testing regimen and then incrementally attempting to reopen. They have had some setbacks in their ability to reopen. Just as you said, quoting Frieden, it is not a light switch and on and off in a traditional sense. But what have you gathered from the stories you've aggregated on the state of Europe right now, the recoveries in the countries that were really hit hard, Italy, France, and Spain, and Germany's had a unique story in really limiting the number of deaths, at least the number of reported deaths.
Right. So they're, reopening slowly. That seems to be the consensus over there. And every country is slightly different in what they're doing. I guess in many ways, like the states are sort of just as the shutdowns went with the states determining what was shutting when and how, the reopening seems to be happening like that also. Because there are some places less affected, some places much more affected. But, case counts are still rising. When you look at the curves, it's not encouraging right now. And the new modeling is not encouraging either. So, it's all worrisome. I've been worried since probably January 2nd or 3rd. And then, yeah.
Yeah, well, I'm sure you found to some extent your amazing news source to be both draining emotionally, but also an escape. But for those who were perceptive to see this as a looming global phenomenon, if not catastrophe, the teachable moment can sort of constantly be on Twitter because that's sort of your encyclopedic account of following this well before World Health acknowledged the global emergency or a global pandemic. And
that's because of people like Osterholm and Sid Rapp and flu trackers and organizations like that. They've been following this stuff for years. They've been writing about this for years. If they're alarmed, then we should be alarmed. And I think Sid Rapp is one of the best sources for information, and they're putting out this new viewpoint, which is really great. It's Osterholm and Lipsitch and some of the other big names in epidemiology. So I think it's incumbent upon us to find those experts, those world-renowned people who have spent their lives studying diseases, whether they're epidemiologists, virologists, infectious disease doctors, seek them out as sources of information. They're accessible. They're on Twitter. There's a international consortium of virologists. You can find all the reliable information, the latest information, and much of it is tweeted out in very basic language, accessible language. You can only do so much with the number of characters you have in Twitter, and I think part of the reason they use Twitter is to sort of not just get the message out to other experts, but to get it out to the public, because it's incumbent on us to protect ourselves from this.
Exactly. And you've been very helpful in protecting us and Twitter and our virtual neighbors with your account. And I'm sure that our fellow Americans, Californians, New Yorkers, anyone listening on PBS or to our podcast can also follow you for the latest developments on treatment and vaccines, because that's something you're actively tweeting about too in the minute we have left. Is there any particular room for hope that you have? The last thing I read was about llamas, which I happen to have in the far back of
llamas, right?
And the antibodies that llamas may have.
Yeah. There's good news and bad news every day. The bad news is the vaccine is pretty far out. The good news is there might be a therapeutic sooner rather than later. I wouldn't have an idea of timelines for those things. I did spend part of my career doing clinical research, 10 years doing clinical research studies, human clinical trials. And, it takes a long time to make sure something is safe and effective. It can't be rushed because there can be great harm done to human subjects if it is rushed. So I'm hopeful for a therapeutic, something that can help with mortality. I think we're looking at a different world. We're living in a different world. And I really think the most important thing is to educate yourself so that you can mitigate your risk.
Rachel Graham, author and news aggregator of COVID-19 on Twitter. Thanks so much for joining me today on The Open Mind.
Thank you. Thank you for having me.
Please visit the Open Mind website at 13.org/openmind to view this program online or to access over 1,500 other interviews. And do check us out on Twitter and Facebook at Open Mind TV for updates on future programming.
Continuing production of The Open Mind has been made possible by grants from Ann Olnick, Joan Gans Cooney, Lawrence B. Benenson, the Engelson Family Foundation, Alfred P. Sloan Foundation, the John S. and James L. Knight Foundation, William and Flora Hewlett Foundation, Joanne and Kenneth Wellner Foundation, and from the corporate community, Mutual of America.